I'm about to show you the visible warning signs on your skin and body that often appear years before a formal diabetes diagnosis is ever made by your doctor. Most people wait for the classic symptoms like extreme thirst or frequent urination, but the body usually signals for help much earlier through changes in the texture and color of your skin. These are signs you can see in the mirror right now if you know exactly where to look and what to look for. I remember a patient named Arthur, a 72-year-old gentleman who felt perfectly fine and had not been to a doctor in years because he believed his health was excellent. He came to see me only because his wife noticed a small change on the back of his neck that wouldn't wash off, and she was worried it might be something serious. Arthur felt silly coming in for a skin issue, but that visual cue was the only reason we caught his skyrocketing blood sugar before it caused permanent damage to his heart or vision. It is frightening to think about how many seniors are walking around right now with dangerously high glucose levels, completely unaware because they are waiting for pain or illness to strike first. Your doctor might have told you that your numbers are borderline or a little high, but they may not have told you to inspect your skin for the evidence of what that sugar is actually doing to your cells. This uncertainty is dangerous because high blood sugar acts like a slow poison, damaging your nerves and blood vessels silently until the visible signs appear. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes, so always consult with your doctor before messing with your medication. The first sign is something called Acanthosis nigricans, which is a complicated medical term for a very simple visual change that looks like dark, velvety patches on your skin. This is one of the most common early warning signs of insulin resistance, yet it is arguably the most frequently ignored symptom because it looks so harmless. You might notice this darkening in the creases of your neck, under your armpits, or even in the groin area, and it often feels slightly thicker or softer than the surrounding skin. I recall a patient named Eleanor, a lovely 68-year-old woman who loved gardening and spending time outdoors in the sun. She came into my office for a completely unrelated issue, but I noticed she kept rubbing the back of her neck self-consciously while we were talking. When I asked her about it, she admitted she was embarrassed because she thought she had forgotten to wash her neck properly after working in the garden, no matter how hard she scrubbed. Eleanor had been using exfoliating scrubs and harsh soaps for months, trying to remove what she thought was stubborn dirt or a tan line that wouldn't fade. She was frustrated and confused because the more she scrubbed, the more irritated the skin became, but the dark color remained exactly the same. She told me she had even stopped wearing her favorite open-collar shirts because she didn't want her friends at the community center to think she had poor hygiene. The reality was that Eleanor's skin was not dirty at all. It was reacting to the high levels of insulin circulating in her bloodstream. When your body becomes resistant to insulin, your pancreas pumps out more and more of it to try and manage your blood sugar levels. High levels of insulin can stimulate skin cells to reproduce much faster than normal, leading to a buildup of tissue that contains more melanin, which makes the skin look darker and feel velvety to the touch. This is a classic example of how your body tries to communicate with you externally about an internal struggle that you cannot feel. The tragedy in Eleanor's case was that she had delayed getting blood work for almost 2 years because she felt healthy, all while her skin was screaming that her insulin levels were unmanageable. Once we addressed her diet and lowered her insulin levels, the dark patches began to fade, but it took treating the root cause rather than treating the skin itself. If you notice a darkening band around the back of your neck or in your armpits, do not assume it is just dirt or a shadow from aging skin. Take a moment to feel the texture. If it feels velvety or thicker than the skin on your face, this is a strong indicator that you need to check your blood sugar. It is not a skin disease, but rather a skin symptom of a metabolic problem that needs your immediate attention. This supports steadier readings because recognizing this sign early allows you to intervene before the insulin resistance progresses to full-blown diabetes. The next visible sign is the appearance of light brown, round, or oval scaly patches on your shins, medically known as diabetic dermopathy. These spots are often confused with normal age spots or minor scars from bumping into furniture, which is why so many seniors overlook them entirely. They typically appear on the front of both legs. They do not hurt, they do not itch, and they do not open up or bleed, making them very easy to ignore. I had a patient named Walter, a 75-year-old retired carpenter who was used to having scrapes and bruises on his legs from years of physical work. He noticed these small, light brown circles appearing on his shins but assumed he had just been clumsy and bumped into the coffee table without realizing it. He watched them for weeks, expecting them to fade like a normal bruise or heal like a normal scrape, but they stayed exactly the same size and color. Walter's mistake was assuming that because the spots didn't hurt, they weren't important, which is a dangerous assumption when dealing with high blood sugar. He finally mentioned them to me during a routine checkup, jokingly asking if I had a cream to make his clumsy marks go away so his legs would look better. When I examined them, I realized immediately that these were not bruises from trauma, but rather evidence of damage to the tiny blood vessels under his skin. High blood sugar damages the small blood vessels, or capillaries, that supply oxygen and nutrients to your skin tissues. When these vessels are damaged, they can leak small amounts of blood or simply fail to nourish the skin properly, leading to these permanent brown changes. In Walter's case, these shin spots were the only visible sign that his diabetes was uncontrolled, as he had no other symptoms like thirst or fatigue at that time. It is crucial to understand that these spots are harmless in themselves and do not require treatment, but they are a massive red flag for what is happening inside your kidneys and eyes. If your blood sugar is high enough to damage the capillaries in your shins, it is likely high enough to be damaging the capillaries in your retina and your kidneys as well. Walter was shocked to learn that his bruises were actually a systemic warning sign that his small blood vessels were struggling to survive in a high-sugar environment. A recent study published in a prominent dermatology journal highlighted that over 50% of patients with diabetes will develop some form of skin manifestation, often before diagnosis. This research underscores that the skin is not just a wrapper for the body, but a dynamic organ that reflects your metabolic health in real time. Knowing this gives you a massive advantage because you can look at your shins today and get a clue about your blood vessel health without needing a lab test. If you have these spots, the best thing you can do is not to buy expensive creams, but to focus entirely on stabilizing your glucose levels. Moisturizing can help keep the skin from becoming too dry, but it will not remove the spots because the issue is vascular, not superficial. Walter found that once he got his blood sugar in a healthy range, no new spots appeared, although the old ones remained as a reminder of his past glucose levels. Comment your age and your usual fasting number below if you know it, or let me know if you have ever noticed spots like this on your legs. Number 3. Another significant sign to look for is a condition called necrobiosis lipoidica, which manifests as yellowish, waxy plaques on the skin. Unlike the shin spots we just discussed, these patches often start as small, raised red bumps that slowly turn into larger, shiny patches with a yellow center. The skin over the affected area can become very thin and practically transparent, allowing you to see the blood vessels underneath clearly. I remember a woman named Martha, aged 64, who came to me because she was convinced she had a strange infection on her lower left leg. She described a patch of skin that looked like a shiny scar with a violet border, and she had been applying antibiotic ointment to it for months with absolutely no improvement. Martha was worried because the area felt firm and waxy, unlike any other skin on her body, and she was terrified it was going to spread to her other leg. Martha's situation was a classic case of misinterpreting the body's signals. She was treating a surface-level symptom while ignoring the metabolic storm underneath. She told me she had stopped wearing skirts to church because she didn't want anyone to ask her about the ugly sore on her leg. The mistake she made was assuming that because it looked like a sore or an infection, it must need medication applied directly to it. This condition is much rarer than the shin spots, but it is highly specific to diabetes and often indicates that blood sugar levels have been elevated for a significant period. The waxy texture comes from the breakdown of collagen in the skin, which is accelerated by high glucose levels and inflammation. In Martha's case, her A1C levels were significantly higher than she realized, and her body was breaking down its own connective tissue as a result. We had to have a serious conversation about how no amount of antibiotic cream would fix a problem caused by sugar in her bloodstream. I explained to her that the infection she feared was actually a structural change in her skin caused by chronic inflammation. Once Martha understood this, she shifted her focus from the medicine cabinet to the kitchen, which was the only place she could truly treat the root cause. It is important to note that these plaques can sometimes be itchy or painful, and because the skin is so thin, they can crack open and form slow-healing sores. This makes it vital to protect the area from injury, as the healing capacity in that specific patch of skin is very poor. Martha learned to be very gentle with her legs, wearing soft socks and avoiding any trauma to the area while she worked on her diet. If you see a patch of skin that looks shiny, porcelain-like, and yellow with visible blood vessels, do not ignore it, and do not just cover it up. This is a sign that your body is experiencing significant inflammation and collagen breakdown due to metabolic stress. You should bring this to the attention of your doctor immediately, not for a skin cream, but for a comprehensive review of your blood sugar management plan. This supports steadier readings because catching this condition early prevents the skin from breaking down further and becoming a portal for serious bacterial infections. The fourth sign is the sudden appearance of numerous skin tags, specifically in clusters around the eyelids, neck, or underarms. While it is normal to get a skin tag here or there as we age, having a sudden crop of them appear over a short period is a distinct warning sign. These are small flesh-colored growths that hang off the skin, and they are directly linked to the same growth factors that cause the dark patches we discussed earlier. I treated a patient named Henry, a 70-year-old retired accountant who prided himself on his professional appearance. Over the course of 6 months, he noticed a dozen small tags developing around his collar line and on his eyelids, which he found incredibly annoying. He went to a dermatologist to have them snipped off because they were catching on his shirt collar and his glasses, causing him discomfort. Henry thought these tags were just a cosmetic nuisance of aging, simply bad luck or genetics playing a cruel trick on him. He had no idea that the sudden multiplication of these tags was his body's reaction to hyperinsulinemia, or too much insulin in the blood. When he came to my office for a general checkup, I noticed the small scars where he had them removed and asked him about the timeline of their appearance. The connection between skin tags and blood sugar is strong because insulin is a growth hormone. It tells cells to grow and divide. When you have too much insulin floating around due to insulin resistance, it can overstimulate the skin cells in high-friction areas, causing them to grow out into these tags. Henry was shocked to learn that his cosmetic problem was actually a metabolic problem, and that snipping them off didn't stop the internal signal that was causing them. We used this visual evidence to motivate Henry to make changes to his daily routine, specifically focusing on how he started his meals. I introduced him to a simple concept of eating his fiber and protein before his carbohydrates, which helps to flatten the glucose spike and reduce the insulin surge. By blunting the insulin response after meals, we could remove the chemical signal that was telling his skin to produce these tags. Another helpful step is to engage in a light 10-minute walk immediately after your largest meal of the day. This simple movement helps your muscles soak up the glucose from your blood without requiring as much insulin from your pancreas. Henry found that by adding this short walk, he not only felt better but also stopped noticing new tags forming on his neck. If you notice that you are suddenly growing a crop of skin tags, do not just rush to have them removed without asking why they appeared. Look at your diet and your blood sugar trends because your skin is telling you that your insulin levels are running too high. Addressing the insulin resistance is the only way to prevent them from coming back again and again. This supports steadier readings by tackling the root cause of the growth factor, ensuring your body doesn't need to pump out excessive insulin to handle your meals. The fifth visible sign is one that you might see every morning when you brush your teeth: swollen, red, or bleeding gums. Many seniors attribute bleeding gums to brushing too hard or simply getting older, but gum disease is actually a bidirectional marker for diabetes. This means that diabetes can cause gum disease, and gum disease can actually make your blood sugar harder to control, creating a vicious cycle. I remember a patient named Irene, a 69-year-old grandmother who was very diligent about her appearance, but terrified of the dentist. She noticed that her toothbrush was pink with blood every morning and that her gums looked puffy and red, but she convinced herself she just needed a softer toothbrush. Irene avoided the dentist because she was afraid of the pain, so she lived with the low-grade inflammation in her mouth for over a year. Irene didn't realize that the high sugar in her blood was also present in her saliva and the fluids around her teeth. Bacteria in the mouth love sugar. It is their favorite fuel, and when they have an abundant supply, they multiply and cause massive inflammation. This inflammation doesn't just stay in the mouth, it raises inflammatory markers in the whole body, which in turn drives blood sugar even higher. When Irene finally came to see me, she was complaining that her blood sugar numbers were erratic, despite her being fairly careful with her diet. We traced the problem back to the chronic infection in her gums, which was keeping her body in a state of stress and inflammation constantly. Once she received proper periodontal treatment and got the infection under control, her blood sugar numbers dropped significantly without any change in medication. It is vital to understand that if you have high blood sugar, you are at a higher risk for infection because your white blood cells do not function as well in a sugar-rich environment. This is why a small gum issue can turn into a major problem much faster for a diabetic than for someone with normal glucose levels. Irene learned that her oral health was a non-negotiable part of her diabetes management, not just a cosmetic concern. One effective long-term lever you can pull is to act as if your mouth is the gatekeeper of your health. Flossing daily and using a water flosser can reduce the bacterial load significantly, removing the source of inflammation that might be spiking your sugar. It is a simple mechanical change that pays huge dividends for your metabolic health. If you see blood in the sink when you brush, do not ignore it and do not assume it is just old gums. Take a look at your fasting glucose numbers and consider that your mouth is showing you the level of inflammation in your entire body. Treating your gums is effectively treating your diabetes, and vice versa. Also, be mindful that if you use insulin or glucose-lowering medication, resolving a major infection like gum disease can cause your sugar to drop because the inflammation is gone. You will need to monitor your readings closely as your mouth heals to ensure you don't experience a low blood sugar event. This supports steadier readings by breaking the cycle of inflammation that keeps glucose levels artificially elevated. Another helpful habit is to regularly subscribe to channels that provide you with this kind of detailed health information. This leads us to the halfway point of our list, and the next signs become even more subtle but equally dangerous if missed. The eyes and the feet often hold the secrets to your diagnosis long before a blood test confirms it. One more easy change is to share this video with a friend who might be ignoring these signs. Number 6. The sixth sign is often dismissed as a natural part of aging, but it is actually a direct reflection of your blood sugar levels fluctuating throughout the day, blurry vision that comes and goes. This is not the permanent vision loss associated with long-term damage, but rather a temporary swelling of the lens in your eye that changes your prescription from hour to hour. When glucose levels are high, fluid is pulled into the lens, changing its shape and making it difficult to focus, only for it to return to normal when sugar levels drop. I recall a patient named George, a 73-year-old man who was incredibly frustrated with his optometrist because he felt his new glasses were never right. George had bought 3 different pairs of reading glasses from the drugstore in a single month, convinced that his eyes were rapidly deteriorating due to his age. He told me that some days he could read the morning paper perfectly, but by the afternoon, the words were swimming on the page, and he had to switch to a stronger pair of glasses just to finish an article. George's mistake was assuming that his eyes were the problem rather than realizing that his eyes were simply reacting to the changing chemistry of his blood. He didn't know that the lens of the eye is highly sensitive to changes in fluid balance, and that high sugar acts like a sponge, drawing water in and distorting his vision. He would go to the store when his sugar was high, buy glasses that worked for that specific moment, and then find them useless when his sugar dropped later in the day. When George finally came to see me, it wasn't for his eyes, but I noticed he was squinting at the paperwork, despite wearing glasses that looked brand new. We checked his blood sugar right then and there, and it was significantly elevated, explaining why his vision was currently blurry. I explained to him that buying more glasses wouldn't fix the issue because the prescription of his eye was changing every time he ate a high-carbohydrate meal. This fluctuation is a critical early warning sign because it happens long before the permanent damage of diabetic retinopathy sets in. If you notice that you can see clearly in the morning but things get fuzzy after lunch, or vice versa, do not rush to the eye doctor for a new prescription immediately. Instead, use that blurriness as a signal to check your blood sugar, as your vision is acting as a real-time glucose monitor. For George, the solution wasn't a stronger lens, but a steadier diet that kept his blood glucose from spiking and crashing. Once we stabilized his sugar levels with a lower carbohydrate approach, his vision stabilized as well, and he went back to wearing his old glasses without any issues. It took about 4 weeks for the swelling in his lenses to fully resolve, which is a common time frame for this type of recovery. Another helpful step is to ensure you are drinking enough water throughout the day to help your kidneys flush out the excess sugar. Dehydration can worsen the concentration of glucose in your blood, which in turn exacerbates the fluid shifts in your eyes. George found that by staying hydrated and watching his carb intake, his aging eyes suddenly became sharp again. This supports steadier readings because consistent hydration helps maintain a stable fluid volume in your blood vessels, reducing the strain on your eyes and kidneys. Number 7. The seventh sign is one that requires you to look all the way down at your feet. Slow-healing sores, blisters, or cuts that you might not even remember getting. This is a terrifying combination of two problems caused by high sugar. Poor circulation, which prevents healing factors from reaching the wound, and nerve damage, which prevents you from feeling the pain of the injury in the first place. I had a patient named Betty, a 77-year-old woman who was meticulously clean and took great pride in her appearance. She came to see me because she noticed a dark stain on her white sock when she took her shoes off in the evening, but she felt absolutely no pain in her foot. When we took the sock off, we found a significant blister on her heel that had rubbed raw and was beginning to look infected, yet she hadn't felt a thing while walking around the grocery store all day. Betty was shocked because she had always relied on pain as her body's alarm system, assuming that if something was wrong, she would hurt. She had bought a new pair of shoes that were a little tight, and because high blood sugar had damaged the sensory nerves in her feet, her brain never got the signal that her skin was being rubbed away. The high sugar in her blood also meant that the white blood cells needed to fight off bacteria were sluggish and ineffective, allowing the wound to fester. This is why foot issues are the #1 cause of hospitalizations for complications related to diabetes, often starting with something as small as a pebble in a shoe or a blister from a new sandal. Betty's story is a stark reminder that you cannot rely on feeling pain to tell you that you have an injury if your blood sugar has been high for years. The silence of your nerves is the symptom itself, and it is one of the most dangerous signs on this entire list. If you have cuts that linger for weeks or red spots on your feet that never seem to go away, this is a clear indication that your body's repair systems are being blocked by glucose. We had to treat Betty's foot very aggressively to prevent the infection from spreading to the bone, a complication that can lead to amputation if not caught early. She learned that inspecting her feet was not just about hygiene, but a critical daily medical exam that she had to perform herself. Most older adults can try this safely by placing a small mirror on the floor if they have trouble bending over to see the bottom of their feet. This simple tool allows you to check for any red spots, cracks, or blisters without risking a fall or straining your back. Betty made this part of her morning routine right before putting on her socks to ensure she never missed a warning sign again. A recent study confirmed that daily foot inspections reduce the risk of severe complications by a massive margin, simply because problems are caught while they are still small. You do not need a medical degree to do this. You just need to look for anything that breaks the skin or looks red and angry. If you see something, do not wait to see if it heals on its own. Treat it as an urgent matter because your body needs extra help. This supports steadier readings because preventing infection keeps your stress hormones low, which in turn helps keep your blood sugar from spiking in response to the illness. If you know someone over 50 who could benefit from this, share this video, and subscribe for more simple senior health tips.